Hello everyone, and welcome to the fourth week of the Developmental Psychology course. This week's topic is sensory and perceptual development. Let's start with a few concepts of early sensory experience. Sensation is all about the raw data our senses pick up. Think of it as the initial experience when our sense organs, like our ears, get stimulated. For example, when you hear a sound, you can tell if it's a high-pitched whistle or a low, deep drum beat. That's sensation at work. Perception takes things a step further. It's how we interpret those sensory signals based on our past experiences. So when you hear a familiar tune and think, "Oh, that's Hit Me Baby One More Time," you are using perception to recognize and give meaning to the sound. Attention is like a spotlight that helps us focus on specific sensory inputs while ignoring others. Imagine you are at a noisy party, but you can still concentrate on your friend's voice amidst all the chatter. That's your attention filtering out the distractions so you can concentrate on what's important. Pain is not the nicest feeling, but it helps us stay alive by teaching us to avoid harmful things. Even fetuses can feel pain, starting around the 20th week of pregnancy. This is why in the countries where abortion is allowed, have laws banning abortion from that period onward. For newborns, their brains are still in the crucial stages of development. This means that any painful experience can potentially harm their developing neurons. It's a delicate time for their growing brains. Take, for example, newborns who need frequent needle pricks for diabetes tests. These little ones tend to react more strongly to blood tests compared to other newborns. Their repeated exposure to pain makes them more sensitive. Similarly, male babies who undergo circumcision without anesthetic often show increased sensitivity during vaccination 4 to 6 months later. Their early painful experiences can have lasting effect on how they perceive pain. Did you know that fetuses can feel touch as early as 2 months after conception? In fact, the fetus displays the first sign of sensitivity to external stimulation through reaction to touch. As early as 2nd month following conception, the fetus responds to stroking at the side of the mouth. Touch sensitivity increases over the first several days of life. Touch plays a crucial role in increasing positive emotion and visual attention during interaction between infants and their caregivers. A hand placed on the newborn's chest can quiet a crying episode, and gentle stroking can soothe even premature babies. For older infants, touch can increase positive emotion and visual attention during interactions between infant and caregiver. Interestingly, parents can usually recognize the infant by touch alone within the first few days of life. This shows how important and powerful the sense of touch is in the early stages of life. Let's also delve into haptic perception, which is a perceptual experience that results from actively exploring objects by touching. Even neonates have some ability to acquire information about objects through touch. For instance, they habituate when the same object is placed repeatedly in their hand and dishabituate when the shape of the object is changed. As infants grow, they take on a more active role in acquiring information through touch and become increasingly skilled in it. By the end of the first year of life, infants can recognize a familiar object by exploring it with just one hand. Newborns have a keen sense of smell right from the start. Babies show positive facial expressions when they smell pleasant scents, like vanilla, banana, and strawberry. On the other hand, they make negative expression when they encounter unpleasant smells like rotten eggs and fish. Interestingly, newborns can distinguish their mother's smell within the first week of life. This ability helps them bond with their mother and feel secure. For example, 3 days old infants tend to orient more towards a part moistened with their mother's amniotic fluid than to a part moistened with the fluid of another woman. By 6 days old, they turn more frequently towards their mother's breast pad than towards the part of another woman. Parents also have an incredible ability to recognize their infant by smell alone within the few days of life. This olfactory recognition plays a significant role in the bonding process between parents and their newborns. Babies are sensitive to taste right from birth. When the fluid that a baby is sucking on is sweetened, the baby tends to suck harder, consume more, and calm down from crying episodes more quickly. Interestingly, if babies are fed with sweetened formula, they often develop a preference for sweetened food late in life. This early exposure to specific tastes can shape their future food choices. Even newborns born prematurely show a preference for sweetened solutions. This finding indicates that their taste receptors are functioning well before the normal birth date. Newborns can distinguish among different tastes. At just 2 hours old, babies make different facial expressions when they taste sweet and not sweet solutions. They can also differentiate between sour, bitter, and salty tastes. Around 4 months of age, they begin to prefer salty tastes, which they initially found aversive as newborns. These reactions to tastes are thought to be controlled by the brainstem, the more evolutionary primitive part of the brain. This suggests that infants' reaction and differentiation of tastes may reflect primitive innate sensitivities that were evolutionarily programmed to support survival. However, these innate taste preferences can be influenced by early exposure to particular flavors, both prenatally and postnatally. For example, the type of formula, whether bitter or sweet, that babies are exposed to before starting on solid food can affect their subsequent preferences for similarly flavored cereals. Vestibular sensitivity refers to our ability to detect gravity and the motion of our bodies, which help us maintain body posture. In adults, any disturbance of the vestibular sense can cause dizziness and make it difficult to stand in the dark. Newborns are incredibly sensitive to vestibular stimulation along all 3 axes of motion, front to back, up and down, and side to side. This sensitivity is clearly demonstrated by the soothing effects of rocking and jiggling on crying babies. These gentle movements help calm them down because their vestibular system is highly responsive. Postural adjustments can also affect a baby's alertness. For instance, babies are often more alert when they are in vertical position compared to horizontal one. Vestibular sensitivity helps us detect gravity and the motion of our bodies, while visual cues provide information about our surroundings. Usually, these two types of cues are consistent, telling us whether we are moving or stationary. However, sometimes they can conflict, leading to confusing effects. For example, if you are sitting in a stopped train next to another stopped train, and the other train starts moving forward, it might feel like your train is moving backward. This is because the visual cues are overriding the vestibular cues. Researchers have studied how this relationship works in infants. They use an apparatus where infants who have started walking, typically around 1 year to 1.5 years old, are placed in a room with walls that can move while the floor remains stationary. When the front and side walls move, visual cues tell the infant that they are moving forward, but vestibular cues indicate they are not moving at all. Interestingly, the visual cues usually win out, and the babies often fall backward in this situation. A similar phenomenon occurs in babies who are old enough to sit up. Even newborns show some adjustment of their heads in response to visual cues that signal movement. This shows that from early age, infants rely on visual information to interpret the sense of motion, even when it conflicts with vestibular information.